Most of the children and adults are suffering from asthma. It has become a common disease affecting most of the people in India, especially in Delhi and Bangalore. Even children are suffering from asthma. Why they are suffering? Because the air atmosphere is fully polluted. So what is asthma? What is that? It has got to do with the atmospheric air pollution. See, the air which we breathe should reach the lungs. Asthma is a disease of the respiratory system. Respiratory system means it is not affecting the lungs. People suffering from asthma, they are concentrating, they are saying something about the lungs only, breathing difficulty, I am not able to breathe properly, etc. So naturally they are always having some puff, or they are going for nebulizer, some tablets, they are filling tablets. Sometimes if it is becoming aggravated, they get admitted in the hospital and all. But it just, even children are not able to come out of this. Children are using puff, etc. and they are not able to sleep during night. Such people can get rid of this asthma very quickly. What is asthma? They are suffering, the people who are suffering from asthma, they are always concentrating only on the lungs. But in this treatment, in alternative medicine, we go to the entire respiratory system. What is the entire respiratory system? It is in the form of a passage to convey the air. Then it continues in the form of some passage here in the throat region. Then the same passage from trachea, it continues in the chest region in the form of a broader tube, and then which is called bronchi. Then it goes on branching into the chest region. Finally, they carry thin wall structure called alveoli. They are responsible for the exchange of air. But only thing is, the people who are suffering from asthma, they are always telling something about the breathing problem only. So when they come for alternative treatment, especially Reiki and acupuncture, we concentrate only on the nose, starting from the nose. We clear the block in the nose. What is asthma first? See, the air which we breathe, it has to pass through the nose, pass through the tube about which I was telling, then it passes through the bronchi, which is again in the form of a tube. Branches also carry the air to reach the alveoli, which is meant for exchange of air. But the passage which carries the air should not have any block. So how does the block come? The air which we breathe is fully polluted. Some people have weak immunity, weak resistance power, and when they take the air, when they breathe, what happens? The passage in the form of nostrils, the passage gets inflammation. First inflammation starts here in the form of, then the person feels block in the nose. Most of the people suffering from asthma, they never know that they have got the block in the nose. First block starts from here, the nose, nasal region, then larynx, pharynx, which are present in here, then it enters into the passage here. So when the polluted air which you breathe, it causes inflammation in this region, and also bronchi, and also the bronch. So when there is inflammation, naturally there is edematous swelling of the mucous membrane lining these passages. When there is difficulty, the passage gets inflamed. The inflammation causes edematous swelling. So once there is edematous swelling, the passage becomes narrow. From the nose onwards up to the branches of the bronchi, which are in the chest region, they become narrow. So the air which has to reach in optimum quantity to fill up the lungs become narrow. So through the narrow passage, the polluted air enters, cause inflamed area, automatically breathing difficulty comes, because lung is not getting enough quantity or optimum quantity of air. Because of that, breathing difficulty. The breathing difficulty is only a symptom. But what is the cause? Cause is here, the nose, interruption for the flow of energy. Then there is a block because of the inflammation of the bronchi, which is called bronchitis. The branches are also getting inflamed. Because of that, there is very little amount of air reaching the alveoli. in the alveoli, thin wall structure called alveoli only, air exchange takes place. Oxygen enters into the capillaries, and from the capillaries carbon dioxide comes. That is only final stage. But here in this alternative medicine, when a patient comes with asthma for nearly 10 years, 20 years from childhood, the person is not able to sleep properly during night. The person has to get up every half an hour or 1 hour, use puff, and then clear the passage. Then he goes. Interrupted sleep during night, especially the the inflammation gets aggravated, or breathing trouble starts. To clear this, what we do, we go to the chakras which are responsible for sending the air into this. Uninterrupted flow of energy should be there. So inflammation should be removed first. For this, we have to go to the Agnya chakra, which is responsible for sensory organs. One of the sensory organs is in the nose. Once we keep our hand on the Agnya chakra, which is present here, the nasal passage gets cleared. Then we go to the Vishuddha chakra. The passages for the air gets cleared. Then the passage which is in the form of bronchi branches here. When you go to the Anahata chakra, passage gets. Inflammation can be totally removed by going to these chakras, Agnya chakra, Vishuddha chakra and Anahata chakra. Once the inflammation is removed, automatically passage becomes broader, allowing the full quantity of air to reach the alveoli, which is meant for exchange of air. Automatically lungs starts regaining its breathing power. This is one way of treatment. The person who is suffering for the past 10 years, 20 years, 5 years, etc., or 1 month, suddenly it comes. All these people can get rid of this in 2 or 3 sittings, 2 or 3 sessions itself. Another way of treating this same asthma is by acupuncture. In Sujok acupuncture, all the organs are represent the hand only. This is the head. In the head only you have got all the sensory organs. This is where the nose is present. Then this is the region called throat. Here the bronchi is present. The entire lungs are represented here. So when you go to this is the nose. Now first we just apply pressure here. Apply pressure here. Once we apply pressure here, automatically the painful area we can diagnose. For diagnosis itself, we use only the probe. Wherever the block is, we just try to find out by diagnosis, and treatment itself is by applying the pressure or acupuncture needles. So apply pressure here. This clears the nose. We apply pressure here, find out where the painful area is. Then this clears the trachea, throat, pharynx, larynx, and then trachea. Then we go to the chest. This is the chest region. Here bronchi is present, the form of a broader tube. Then the lungs are present here. When I apply pressure like this, automatically the inflammation just goes. Simple treatment is one finger here, another finger here, another finger. If you just apply pressure here continuously for 10 minutes 3 times a day, early morning, lungs are very active. At that time only asthma patient feels the aggravation. So just clear the passage during daytime, automatically the patient will be able to sleep very well without even using the puff or anything, irrespective of the number of years. It may be chronic, it may be acute. It need not be only due to polluted air. Sometimes due to emotional disturbance also, some people get the asthmatic attack. So it need not be only physical, it need not be only polluted air. Even emotional problems also can be the cause of the asthma. So treat Agnya chakra, Vishuddha chakra, Anahata chakra. The energy reaches the root cause of the problem. Automatically symptom of breathlessness just vanishes. So treatment is very easy. Learn this acupuncture, Sujok acupuncture, where organs are represented here. If you learn, you can treat yourself, you can treat others also.